All right, we will go ahead and get started on doing the roll call. Now we do roll call just for those individuals who are calling in, because if you are on Zoom, what you can do to help us is to click on your own picture on the, let me double check how I changed my name. I can't remember now how to change my own name. Let's see, if you can add your name to the bottom corner of your Zoom, that's helpful, or your agency name and agency. If you right click on it, you can on your name, you can hit rename, and then you can put your information in there. So that makes it easier when we are doing our attendance sheet. For those folks who volunteer to do that for us, they do appreciate that. Otherwise, they're trying to figure out who everybody is. But we will go ahead and have those who are on the phone calling in unmute themselves and just let us know who you are and where you're from.
We just have one person. It's the 941-201-8851.
Okay.
So if you could press, I think it's like *6 if you're on the phone.
Some of them have names. Okay.
I'm here with Sandra Martin as well. So there are two people here. It's Lisa Moskin, M-O-S-C-H-I-N.
Thank you.
Sandra Patton Martin. Morning.
Good morning.
Good morning. I don't think the person on the phone, are they still showing? I don't even see them now.
They hung up.
They were like, nope, not gonna introduce myself. All right, well then we'll get started. Today's gonna be a little bit of a different PATH meeting. And so traditionally our PATH meeting follows a very similar agenda. Each month we have our funding source update, client challenges and agency announcements, and then a guest speaker. We do have all of those things, but we need to keep it really tight today so that we can make sure we have enough time for our speaker and training today. So we're going to make sure that everything else is completed by 9:30 so that we can turn it over for our point in time count training. So first and foremost, Happy New Year. Welcome to 2022. I think I've written January 2021 about 1,000 times already this month, but I'll get there eventually. So let's pop up, Margie, the funding source update. There are just a couple of changes. Our Turning Points has a grant through the city that is for hotels. You can see that here, it's grayed out. Those funds are used at this point. And so we do not have that hotel assistance any longer. It doesn't mean that we won't try for some more, but that's where we are today. It's out of funding. And this will be emailed out to you. So if you got invited, if you received the invitation to this meeting, then you will receive this as well as any flyers anybody sends out. After the meeting, we will always forward those on. If you heard about this meeting from a friend and you are not invited by PATH, then please put your email address in the chat and we will add you to the regular PATH email list, and this will go out to you. So this shows you who has what funds, what are they for, what makes somebody eligible, type of assistance they can get, and how to refer somebody. Again, please do not give this to clients. This is not meant to go directly to clients. This is meant for you as providers to assist our clients and letting them know there may be something available for them. We can't promise them these funds. Of course, there's a great eligibility process for most of them, but you certainly can utilize this yourself to let them know that there may be funds available for them. So we will email this out to everybody. Okay. Are there any other funding updates? If you have a funding update or you have a grant you want to add to this grant matrix, you certainly can. You would just reach out, email the information to path@tpmanatee.org. Does anybody have any other funding updates? Okay. It is time, just so you know, we are all getting started ramping up. Manatee County has sent out emails regarding the opening of some of their grant funding. And so if you haven't got that, I'm sure you can access that on their website. I will have to look at my emails and share that with you. I'll put it into the chat because we want to make sure that folks are seeing the available availability for funding and when to turn in their applications. I know there's some video Zoom meetings coming up to help folks with understanding what you can apply for through the county funding and what you cannot. So I will put that in the chat. I'm going to quickly, again, keeping it a little fast today. Any client challenges. So this is the opportunity. If you have a client where you just can't figure out how to get them help in one particular area, you can utilize the brain power of the 60-some folks on this meeting to see if they perhaps have a resource you haven't heard of. Does anybody have any client challenges?
Deputy Jewett, I have one.
Good morning. Please go ahead.
I have a family of 4 that are at the Salvation Army right now. We did do an access point with them. They are undocumented, and then we have the language barrier on top of that. So I don't know if we have anybody who specifically works with people in their situations, but they were living in a cargo trailer, like a utility trailer that you pull behind a truck. And we found them at the movie theater parking lot. So if anybody has any suggestions or ways I can help them to get them off of a mat on the floor, I'd really appreciate that.
Okay. Is anybody aware of programs, services for those individuals? Being that they're undocumented, of course, makes it a little bit more challenging. Does anybody have any suggestions or ideas for Deputy Jewett?
Does any of this is Dora from Hope, is any of it DV related?
No, it's a mom. Dad just started working with the construction company last week, so an income will be coming in. But it's just mom, dad, and then a 4-year-old and a 10-year-old.
Oh, okay.
Okay, somebody posted in here possibly season of sharing. Andy or Ursula, can you talk to that, whether they would be eligible for season of sharing funds potentially?
If somebody, even if one of the kids is legally in the US, we could probably make it happen. But if no one has documents, not much we can do.
Okay, Alba, do you want to talk to us about what JFCS might have available?
I know we have donor funds, and sometimes situations like that we'll be able to help. It's just a matter of maybe referring the family there and seeing if we will be able to help.
Okay.
Okay. It cut out whenever Andy started talking it first on my end, at least.
Sure.
The kids are documented, so
Yeah, I think we still help even though they undocumented.
Oh, we can have somebody applying that.
I'm sorry?
Was that for me or for somebody else?
Sorry, you cut out just a little bit. Sorry, if you could repeat it.
I said the children are documented. They were born here.
Yeah, so then there shouldn't be any problem. Just reach out to JFCS and they'll be able to help you. There's a couple of programs like Season of Sharing. They have BSF and maybe the donor fund. They'll be able to help them.
Is there a particular person, Alba? It is always helpful if we know who to call, who to reach out to directly. Is there someone that you would recommend Deputy Jewett reach out to?
Maybe she could reach out to Carolina Espinal. She runs that BSF program. She could ask for her. If you want, I'll give you the number. I'll put it on the chat.
Deputy Jewett, did you receive that? Alba, if you go ahead and put that in the chat for us, I'll make sure that she gets that. I believe, I don't know if she was able to, she was cutting in and out, so we can make sure that she gets that information. Thank you.
I know I've used St. Vincent de Paul before. I've referred them there because they, I think, as well have certain funds that might be able to help clients who are undocumented.
Okay. And I know sometimes we have worked in partnership with St. Vincent de Paul to put up some funds here ourselves, some through St. Vincent de Paul. JFCS may be able to do the same thing, you know, to kind of partner and move families ahead. So we will make sure that Deputy Jewett gets that information. What else? Any other client challenges? Nothing? Everything's easy peasy right now? I like that. And hopefully we're able to, you know, be providing services to folks that need them. Any,
I have one. I have a client challenge.
Lashana, let's hear it.
Of course, I'm Lashana with Family Resources. We are a shelter for runaway homeless youth. We have a current youth in our shelter where mom does not have the money to pay for her medication. Is there any way that, is there anyone that could assist with possibly paying for her medications?
Do you know if it is mental health medication or physical health medication?
Physical health.
Okay. That's a good question. Pharmaceutical services tend to be a challenge as well. So I can, pardon, go ahead. Hi, Annie.
Oh, sorry, WeCare might be able to help depending on her income.
Okay, mom is receiving disability. So that's the issue. She's not able to.
So, so two things. We did receive in the chat that St. Vincent de Paul does help with medication. And also Annie from WeCare is saying WeCare may be able to assist with medication. So that could be an outreach to make.
Okay, thank you so much. I'll reach out to Annie.
Okay, thank you. All right, we still have a little bit more time. Is there anybody else that is having challenges, client challenges that they would like assistance with? Nothing at this time. All right. How about agency announcements? Anything that agencies want to make us aware of, events that are happening, you know, items like that. Oh, we have something here in the chat. A client is disabled with kids and helps numerous in our community with computer tabulated services. She no longer has computer access. Can we find a way to get her a laptop? There is, I know there's the agency that we give our laptops and computers to that refurbishes them and then provides them out in the community. Margie, are you familiar with the name of that? It starts with an S. I cannot remember the name of it. I know Frank does that. No.
Shrugs.
Yes, that is it.
Shrug.
So they may be an organization that you could reach out to, especially if it's somebody who's going out and assisting others. They may be able to assist with getting a laptop. And you can see it's in the chat there, STUG.
And also Christina mentioned Suncoast Center for Independent Living. They do a lot too for disabled individuals in our community.
Okay. So that might be for the medication request, perhaps?
No, the computer.
For the computer, okay. WeCare, Annie, if you could put your contact information into the chat. Melinda was asking how we get in contact with you.
Yep, I'll do that right now.
Thanks. And we have JFCS says that they are recruiting for the Ignite program. It's a fatherhood program that's 12 weeks long. And you can refer any father or father-to-be to that program. Elba, if you want to send an email, if you have a flyer, I believe you have a flyer, I've seen one, you can send it to path@tpmanatee.org, and Margie can include that with the meeting minutes when we send that out with the grant matrix as well. Judith says, yay, tomorrow is Friday. I agree with you very much. So we have another request here. I have an elderly disabled resident who lives alone and has no car. She has requested an electric cart. So I am assuming that you're asking maybe where she could get an electric cart. Is that what the request is for?
Hi, this is Judy, and we do have we have lots of electric carts that people drop off, but we don't replace the batteries. So the person has to kind of eat that cost. I have had someone recently get one, and there were 2 batteries they had to replace at like $89. So
Okay, and Judith, who are you with?
I'm with Suncoast Center in
Suncoast.
Sarasota, but we serve Sarasota and Manatee County.
Okay, and how would they reach out to you to request an electric cart?
They could call our number. I can put it in the chat. We're at 3281 17th Street. I can put that in there as well.
Perfect, I love it. That would be great. And that is one of the things, there may be funds available. I'm not quite sure how we would get funds for an electric cart, but battery if needed, but sometimes those things can come through. Those are things that agencies will tend to cover with perhaps like donor dollars. So it's not a grant necessarily. I don't know if there's any grants out there that would replace that, but there might be an agency like Turning Points, like JFCS, like St. Vincent de Paul, that if we can show that it's a major need to that person's life, that we may have some donor funds available to accommodate.
I had someone do a GoFundMe. The guy who his father was a veteran. He did a GoFundMe for those batteries.
Awesome. And you got lots of thank yous from people on the chat for that. There must be other people who are looking for carts that now have that information in their pocket.
I think they're saying that about the Friday contest.
You think so? Perhaps. All right. Any other challenges before we move on to our point in time? Or announcements? Any other quick announcements?
We Care is doing a free screening mammogram event on March 28th. So if you have anybody that can't afford them, send them our way.
So what would that look like? How do we send them your way?
Sure. Phone number, I'll put it in the chat. Just call us and we will take it from there.
All right. Any requirements?
Age 40 to 64, uninsured, low income, Manatee County resident. Does not need to be documented.
Now, Annie, I know you have to have a flyer because that's right up your alley, right?
course
So
we do,
send it
yeah.
over to the PATH info and we will include that as well because that's such an important service. We absolutely need to make sure that folks are getting that information.
Yep, I'll send it over.
Okay, and I believe this is Margie that's asking me to mention the Florida Coalition to End Homelessness Conference that's coming up February 21st through the 23rd. You can still register, and I believe they actually extended the early bird through the end of the month. I think they were extending that through the 31st, the early bird registration. So it is in Orlando for those couple of days. So we hope to see many of you there. All right, anything else? This is your last chance for announcement or challenges before we're going to turn it over to our point in time training.
Hi, this is Rosa from WIC. Our waivers got extended again through July so we can continue doing phone services for clients. If they're brand new, we'll encourage them to come in so they can get their EBT card, but after that, we can continue doing over the phone.
Okay, great. Thank you so much. Let me see if there's anything else in the chat.
In the chat, can you please put the information for the homeless conference that you just mentioned?
Margie, can you put the link in there with the
Thank you.
she had a look like, no, I can't. I can
will
send
find
it to you if you would like. I can send it to you. All right, yes, we can do that. We can put that in. And they do now, the website is more up to date. They have on there the full breakout of workshops and speakers. So that's always helpful to see if it's going to be, you know, worth your time. So that will be on there as well. So next up, we have training for the point in time count. So I want to just talk about this really quickly because it is very important. I was not here for the point in time count because we didn't have it last year for unsheltered. We only did sheltered, and that was due to COVID. So this is my first experience, and it may be for some of you as well, or at least the first time here in Manatee County. So it is really important when we are working with people who are experiencing homelessness. Data is really critical. Without data, it's hard to understand the challenges that are being faced or track our success of our programs. You know, do we have less individuals experiencing homelessness? Do we have more? And this point in time count allows us to review data year over year because it is done every year. Again, last year, due to COVID, we did not do the unsheltered count. This year, we will be doing both sheltered and sorry, if you can mute if you're on the line, that would be great. And this allows us to also really look at, HUD uses this data to distribute federal funds based off of the point in time count. So it is very, very critical. And we're going to be doing the training here today. It will go past 10 o'clock. It will probably be closer to 10:30 by the time that the training is done for you, but I'm hoping we can go quickly. But I am encouraging anybody who sees clients or talks to clients who may be experiencing homelessness to get the training, because you may only do one survey, but that survey is critical, just like the rest. And we need to have an accurate count as possible, the most accurate count we can. This training teaches you how to do the count, the surveys, and will provide you with the information that you need in order to do that. So I am going to turn it over to Maureen and Amy. Amy's going to do the training, and Maureen, if there's anything you want to add about making sure that you have data to track who's doing it and all of that. Maureen, it's all yours.
No, I appreciate it. And good morning to everybody. And obviously, as Kathleen has said, this is going to be hugely important this year, especially with the challenges that we're facing with so many of people being homeless and in need. But it's not just, so we have a lot of volunteers that will be going out into the community and into places not that you and I would normally go to, in order to make sure we capture as many people as possible. But we have a huge need to make sure that organizations that serve potentially those that could be homeless, that we capture surveys there, so we get as many people as possible. And then for those of you on the call that are some sort of emergency shelter, whether it be a domestic violence shelter or otherwise, certainly we want to reach out to you so that we can make sure that we capture those people. I'm not going to explain about the survey. I'm going to let Amy do that, but I will let you know that Amy and Suncoast Partnership to End Homelessness in Sarasota County take charge of this survey. Turning Points is concentrating on Manatee. So Suncoast Partnership will be doing the survey in Sarasota, and Turning Points will be doing it in Manatee County. One thing that I would like to do before turning it over to Amy, who I thank very much for doing the training today, is to introduce you to Tina Juliet. Tina is a volunteer at Turning Points, and you've probably seen emails from her. As she's sending out.
Hang on one second, Maureen.
Okay.
Folks, we're getting some background noise. Can you please make sure that you're muted? Please make sure that you're muted. Thank you.
So Tina is going to put, for those of you who don't have it, Tina's going to put her contact information in the chat, and I will also. But if there's any opportunity for you to help us with this survey, obviously we really appreciate you going through the training today, because we do need to obviously make sure you understand what's involved, but also get your consent to do it. For Tina, today is going to be important that she is able to communicate with you regarding when and where you will be doing it. She's created a very nice spreadsheet that lists all the places and assignments we need. So if you're flexible at all, we definitely want to get you into places where there's the greatest need. But please understand that we're going to respect your schedule and any help that you can give us at any time, because in Manatee County, unlike Sarasota, who really defines a 24-hour period, we do it all week. So we're going to be asking Monday where you're going to spend the night, and the rest of the week, we're going to be asking where you spent Monday night. So with all that said, please, if you wouldn't mind putting your contact information in the chat or emailing it to Tina, that would be great. You can just make a note, PIT, Point in Time Homeless Census, and we'll know you're interested in helping us with that. And we did tell a lot of the participants that the training would be starting at 9:30. So I think we're good to turn it over to Amy now.
Hello, I am actually going to share my screen so that we can do this. And I'm gonna put myself on and stop my video. Does everyone see my screen?
Amy?
Yes.
Do you mind if I interrupt just 1 second? Because I did forget to mention one important thing. I am going to share some additional information after your presentation. So I just ask the participants not to sign off immediately when you're finished, because I do have a little more information to share.
Okay.
Thank you.
Does everyone see my my screen? I just want to make sure before I continue on. Okay. Well, this is the 2022 Point in Time homeless census count. And this is the interview training that we go over everything. And if anybody has any questions, please go ahead and put them in the chat. And Maureen and Tina, maybe you could help me answer those by chance.
Absolutely.
So here we'll go ahead and go through it. Okay, so what is the 2022 Point in Time homeless count? Well, it is a street-based, service-based survey process designed to identify how many people who are literally homeless. And that definition I'm going to give you by HUD, what literally homeless is. Because again, this is a federal survey. So it is important that we use their definition. And this is a survey that is conducted in Manatee and Sarasota County at a given point in time. And that time happens to be the last 10 days of January. That is the time that this is done nationally. And so every COC throughout the nation is participating this year in doing the count. The PIT is not a total, literally, total count of the literally homeless, but it's just a snapshot, because we all know people fall into homelessness before the 24th and then after the 25th. So again, this is just a snapshot in time of those. And by doing it on the same date year after year, we're able to look at the progress that we're making. The PIT is a critical source of data on the number and the characteristics of people who are homeless in the United States. This data is used to measure the homelessness on a local and national level. There are other surveys about poverty, education, retention, and employment, but the PIT is the one survey that focuses squarely on the literally homeless and information about those persons. The count has become increasingly important as a measure of our local and national progress related to ending homelessness, especially in relation to our progress towards meeting the criteria and benchmarks of ending homelessness. year after year, we do the survey. Now, I don't have 2020 here, but if anybody wants to look at the sheltered count that we did last year, 2021, that can be found on the Suncoast Partnerships website at suncoastpartnership.org. So who should be counted? Well, again, these are literally, this is based on the HUD definition of literally homeless. So anybody who is in a place not meant for habitation. That means if they're on the street, the sidewalk, vehicle, abandoned building, bus or train station, under a bridge or overpass in the woods. They could even be in a shed in someone's backyard. If it does not have running water and electricity, it is not a place meant for habitation. Emergency shelter, which also includes hotel, motel paid for by the agency or by a church group. It does not, however, cover if the person is paying for the hotel themselves or if their family members are paying for it. So it's only for the ones who are getting shelter from the emergency voucher or from a church group. Transitional housing. Transitional housing is a program for the homeless. It facilitates, movement to independent living. Now we go out, we don't have a lot of transitional housing in either Manatee or Sarasota County, but we have a few. We've got SOB for the mothers. We've got GPD with the Volunteers of America for the veterans. However, a lot of individuals that you may encounter who tell you that they live in transitional housing may not necessarily be in what HUD classifies as the transitional housing. So if you come across individuals who say transitional housing, if you could write on the survey the program that they're in, that will allow me to make that definition and define by HUD standards, because they do not consider halfway houses transitional housing. So that's real important, because, you know, not everybody knows exactly what that definition is. So if they say it, please just write to the side what program, and then you can continue on with the survey. Does anybody have any questions about this so far? If a person does not meet the criteria that we just went over, it is not necessary to complete the rest of the form. In fact, the form was designed to help the interviewer end the survey if a person being interviewed is not literally homeless. This presentation is going to guide to help you ask the questions for the data that HUD requires us to ask and collect for those we survey. This survey is completely voluntary. However, it is really critical that we try to gather complete information. And it's important that we ask every question on the survey form. If the form is not complete, I may not be able to enter that information, so that survey could be disqualified. So again, although it is voluntary, please encourage them to answer as many questions as they feel comfortable to answer. Do not have anyone other than yourself enter the information on the Pick Count survey form. This is really important because we're going to be going over these questions, and HUD can be a little confusing in some of the questions that they ask. So that's why we're doing this, and we do this every year to make sure that you understand what is involved in the question. If you hand the survey to the individual, they may not necessarily be able to answer that correctly. So the questions, there's only 18 this year, and we're going to go ahead and take a look. The first thing you're going to see on the interview form is your name. If you can please put your full name, and that way I know who is conducting the interview. The second is the interview site. This is really a critical piece. Although we know a lot of the locations of the camps and a lot of the agencies, we can use this data to determine next year if we've collected a large portion of surveys from a particular location, that we may want to, again, next year, send someone out to that location. So it helps us pinpoint where to be able to see where the homeless are gathering or are going to. So the first question on the survey, have you completed the survey earlier today or this week? If they say yes, then that's all the questions. We don't need to continue on with the survey. Now, we do have thank you gifts for participating. We'd like to have a complete survey to give them the thank you gifts, but if they've completed it and they're insisting on the thank you gift, go ahead and give it to them. Number 2, where did you sleep on the night of the 24th? As Maureen was saying, the PIT is a 24-hour period, and we're starting that on the 24th, starting at 3 p.m., going through the 25th to 3 p.m. However, HUD allows us to go out 7 days from that date to gather information. So on Monday, the 24th, you may be asking, where are you planning to sleep tonight? However, the remaining days, we are going to be asking, where did you sleep on the night of the 24th? And that is critical. You're allowed to go out 7 days, as I just stated, but we must refer back to the night of the 24th. So in question number 2, we have 2 groups. We have group 1, which is place not meant for habitation, emergency shelter. And again, that includes hotel, motel paid for by agency or by a church group. And then we have transitional housing for formerly homeless persons. If they choose group 1, you are going to go ahead and go on with the survey. If they choose from group 2, a house or an apartment owned or rented, jail, hospital, or treatment program, permanent housing for homeless, foster care, hotel, motel paid for by self or by family, staying with a friend or a relative, you do not need to go on with the survey. You can say, thank you very much. That is the only question I have for now. Again, if they are insisting on the thank you gift, please just go ahead and give that to them. Remember, this again is, where did you sleep on the 24th? It's not a question of where the person once lived or where they usually stay, or even where their family's located. It is about where they and their household slept on the night of the 24th, and only about the 24th. And then we sit there, we take the survey, and then we break it down by counties, because our COC covers 2 counties, Sarasota and Manatee. So as you know, our population is very transient. So you may come across individuals that you interview in Manatee County that actually slept in Sarasota on the night of the 24th. So depending on where they say they slept, we're going to either choose Manatee County or Sarasota County. And you can see there's 2 distinct county lines. That county line is actually the University Parkway. So if they've slept on the one side of University, that would be Sarasota. The other side would be Manatee County. Number 2C is, where did you sleep on the night of the 24th? This allows us to determine if this is a county or within the city limits. And then therefore we can give this information to both the city and the county. We do have maps on the back of the clipboards that you are going to get. And I know sometimes it's very difficult to determine city limits and county limits. So therefore that map is going to be on the back. And you're going to, in Manatee, we'll have the city of Sarasota and Palmetto. In Sarasota, there will be a city map of Sarasota, Northport, and Venice. Inglewood is not a city. Does anybody have any questions about these questions so far? So as you can see, Maureen will have those maps for you. And if you are volunteering in Sarasota, I will have those maps on the back of your clipboard. Now we get into the real questions. Number 3, name. In the past, we've asked for first name, last initial. And if that is all they want to give, that is great. However, if we can get a full name, that is even better. Number 3, name, and number 4, date of birth, help me deduplicate the data. So there may be an individual who spent a night in a shelter and then later on was out in the street and was interviewed. We will be pulling the sheltered count. So they don't know that they have already been counted. So they may get a survey. And so therefore I will have 2 of the same client, the client entered twice. So getting us a full name and date of birth helps us deduplicate this data. So if we can get it, great. If not, then the first name and first initial of the last name are fine. Date of birth, if I can get the full date of birth, great. If not, try to get the year, or else please circle whether they're an adult or child. Gender, that's new this year. Before in the past, they could only choose one gender. This is a multiple selection. So however they identify, you will go ahead and select. For an example, if you have a male transgender who's questioning, that's what you would put, male transgender questioning. Again, that is however they identify. Ethnicity, number 6 and number 7 can be a little complicated. HUD does not consider Hispanic Latino a race. So therefore they separate it out by ethnicity. And the only reason I can think is because there are so many shades in the Hispanic Latino community. So if you come across an individual and you have asked them their race and they say Hispanic, you can say, thank you. I will mark that as ethnicity, but can you tell me which race you most closely identify with? If they do not want to answer that, that is fine, and you can leave it blank. US, serving US military. This is US only, and if they have spent 1 day in boot camp and were released, they are a US military veteran. Regardless of the status, do not need that right now. If they do go to a program that serves military, the military, those agencies will help them get the documentation on discharge, their DD-214. So all you need to know is, did they serve in the military, yes or no? And that again is the US military. 9, 10, and 11. These are the ones that are the most difficult. I always say, I don't remember things 3 years ago myself. So how are we going to expect individuals who are under high stress and have been out and homeless to remember? Well, we're going to do the best we can. And you can prompt them by saying 1 to 2 times or 1 time, 2 to 3 times. So 9 is how many separate times in the past 3 years have you been homeless, including now? So again, you can prompt them. And what stops a homeless is if they are in a house or a residence longer than 7 days. So if they have stayed with their relative for maybe a month and now they're out again, that would be 2 separate incidents. If they were with a relative only maybe like a day and they're out, that would only be 1 separate incident. How long have you been homeless during this current episode? And this is talking about when we referred back to question number 2 and group 1. How long have they been in that place not meant for habitation? How long have they been in the place in the transitional housing? And how long have they been in a hotel, motel, or emergency shelter? Again, please feel free to ask them, is it 1 or less? 2 to 6, you can prompt them. And again, do the best you can, because dates and times when we're looking at a 3-year period can be very difficult to determine. And then we got the total number of months you've been homeless in the past 3 years. Again, Go ahead and prompt them 1 or less, 2 to 6, 9 to 7 to 9. But remember, it should make sense. So if you have an individual who was only one time in the last 3 years, number 9, and they were less than 1 night or 2 to 6 nights, there is really no way for number 11, they could be 12 or more. So think about this and how they ask. And it's okay to go back and reiterate the questions to make sure that we're getting the most accurate data. However, like I said, it's going to be difficult because I can barely remember 3 years ago, and I'm not under that type of stress that they are. So do the best you can, and that's all anybody can ask. 12, do you have a medical or disabling disorder? I said condition, it's now disorder. So this is kind of where you're going to use some of your own. Now they're going to say, hopefully they will give you the answer. However, there's some individuals who don't consider themselves disabled. They may be in a wheelchair, but they don't consider it a disability. So if you come across those, and especially those physical ones that are obvious, we want to go ahead and make sure that we mark that, even though they don't consider themselves, HUD would consider themselves disabled. And if we ever were able to work with the client, we may be able to connect them with a SOAR representative to help them get the income through SSDI. So again, use your discretion on this. If someone is physically disabled, you know, like I said, if they're in a wheelchair, you're definitely going to walk. You want to mark that. Number 13, have you been a victim of domestic violence? And this could have occurred 20 years ago. So that's where number 14 comes in. Are you currently fleeing domestic violence, dating violence, sexual assault, or stalking? If they say yes, in every bag in Sarasota, and there's a flyer that Maureen and Tina will be handing out, it's going to give you hotlines to the different hotlines. I encourage you, if they say yes to this question, that you get that number to them. If you have a phone and you don't mind, because if they don't, you can stand there and let them call the hotline and get them the help they need. However, please do not put them in your vehicle and take them anywhere. Let the people who deal with domestic violence and who are trained to deal with domestic violence handle this. You could put yourself, potentially yourself and the client, at risk. So encourage them to call. If they don't want to call, that's fine. If they do and you don't have a cell phone with you, or you don't feel comfortable allowing them to use it, they can go to Turning Points and use the phone there. Do I have any questions? No. And of course, we had to have this question here. Have you ever tested for COVID? It's a yes or no. Has your homelessness been caused by COVID? If it is a yes, you're going to go down to 16B. If it's a no, you don't have to worry about it. 16B can be a multiple selection. You may have a family that has lost income due to illness or their hours cut back because of it. Or you might have a family that has lost the job and is unable to pay the rent because of COVID. And they may have a family member who, again, lost income due to illness, or a family member who has lost a job and is unable. So again, we're talking about the whole family when we talk about their homelessness, if they are a part of a family. 17, services that your family, you and your family need right now. Again, this survey is completely voluntary, but it's also completely anonymous. Even though I'm asking for an age and a date of birth, that data does not get submitted to HUD or to anyone. We aggregate the numbers and then we submit those numbers. However, if they do want services, I'll need a signature to release that information. And so not only will I be able to release that information to Turning Points and the outreach teams, I'm also going to take those ones that have signed, and I'm going to compare that against our what is called the coordinated entry list, the 1-by-1. And I'd like to do that because I'm going to, if they've signed, send them out to our street outreach teams. And that way we can connect those who have never been connected with our services to where they can find these services: food, housing placement, material goods, and daycare, and so forth. So again, I can't release this information to any agency or street outreach unless I have a signature to do so. Does anybody have any questions about that? So that is the 17th question. 18th question deals with household. So if you have a household or a family, they all have to be in the same situation as the primary client. And what I mean that is they have to have the same situation as 9, 10, and 11, because that's what's going to be put on the household members' information. The other information we're going to collect is their first name or last name, date of birth, age, sex, relationship to the head of household, ethnicity, race, veteran status, and disability. Again, the household member must be in the same situation as the primary client you are interviewing. You do not need to put a separate interview sheet for anyone over the age of 18. So if you come across a husband and a wife or domestic partners, you'll put the primary client in the beginning and the secondary on this last page. And that is it. That is the 18th question. There are 5 areas for the family members. If there are a larger family, you can use a separate form and just use that back sheet for that. And now let's go on to the waivers. Now we're going to need waivers, and Maureen and Tina, I'm not sure if you're going to be putting that out in the chat, the waivers in your packet, but they are going to need the waiver signed. And you can reach out to Maureen or Tina via chat, let them know you're interested, and then they can get that to you. It will need to be signed. You can sign it and scan it back to them. That is completely acceptable. But they are going to need that to be able to assign you a location. Do's or don'ts. For those who have never done this before, please be punctual and responsible. Report to your assigned location at exact time you've signed up to volunteer. If you can't, and if you're anticipating you're going to be late or absent, give them a call so that they can reassign your partner, because everyone should have a partner when they go out. Or they can partner your partner with someone else. Respect the privacy of all homeless individuals. If you are going out into an encampment, remember you were walking into their living room. It doesn't have walls, but it's still where they stay, their living room. So please be respectful of that. And also their confidentiality that they will be entrusting you with. Dress comfortably. And wear comfortable clothes, wear comfortable clothes and shoes. And please, please wear closed-toed shoes. Especially you're going out in some encampments, there are going to be glass and sticks and could even possibly be fire ants. But there's also a possibility that there may be some paraphernalia laying around. So we want to make sure that you are safe. So please wear closed-toed shoes. I'm not saying put on, steel boots, but, a nice big pair of sneakers, comfortable pair of sneakers are important. And be flexible. Maureen and Tina have a lot of locations to cover. So if you're done with your location or there's not adequate activity there, go ahead and give them a holler. I'm sure that they have other areas that they can need help in. And you're going to be safe. You're always going to walk in teams. And it's recommended that both of you keep charged cell phones. And if you feel unsafe, leave the situation. Trust your instincts. Some don'ts. Don't give out your address or your telephone number. Don't give out money to those you are surveying. And don't make promises and commitments you can't keep. Pure and simple, just please don't make promises and commitments. Don't let people ride in your personal vehicle, and don't put your own safety in jeopardy. And whatever you do, do not tolerate a harassment or abuse. If someone is not cooperating, simply mark them on your tally sheet, uncooperative, and move on. Respect them and expect respect in return. If you have any questions about this point in time in Manatee County, you can contact Tina, and her information is here, or you can call, and her phone number and extension are there. And I think, Maureen, are you putting that in the chat as well?
I'm sorry, repeat that question, Amy.
The question about please contact Tina, and is on the screen. So I don't know if you want to put her information in the chat.
Yes, it's already in the chat, as is mine. And actually looking at the chat, we have a couple of questions for you, Amy. So whenever you're ready, I'll clarify those questions that have come through the chat for you to answer for us.
Okay. Well, we have the last one about if you see anybody other than me volunteering the form, please contact us. Because again, this training is to clarify any of those questions. And the clients don't have that opportunity to do so with us. So again, it's important that you fill out the interview and the survey with them. And then there's some topics of engagement, and I'll just leave these up. And Maureen, if you want to go ahead and ask me some of those questions that are in the chat.
Absolutely, thank you. Karen has asked if they say that they weren't in Manatee or Sarasota County, they happen to be in another county the night of the 24th, would we stop the survey at that point?
Correct, because this is only about Manatee and Sarasota County.
Okay, that's what we thought. We just wanted to clarify. Thank you for that. And Pat has a question. She said, please clarify about temporary shelter pauses, such as family friends sheltering with them, and who pays for motels.
Motels must be paid for by an agency or a church group. They cannot be paid for by the client themselves or by their family. This is about the literally homeless, and those who are literally homeless usually have no support system whatsoever. So that's the ones that they are trying to target, those who have no support system, those who are literally homeless. And as far as, was there a secondary question in there? I'm sorry.
It
About the
was,
pause
please
and
clarify temporary shelter.
Temporary shelter, that is either the hotel motel or an emergency shelter. If they go to temporarily to their friend's house for a night, maybe it's really cold that night and their friend says, come on over. If they stay there less than 7 days, then they are still considered literally homeless. And it is less than 7 days is still considered what they consider one episode of homelessness. If they stay longer than 7 days, maybe they stayed 30 and then they were asked to leave again, that would be 2 episodes of homelessness. It's very difficult. Like I said, question 9, 10, and 11 are very difficult to determine because you do not have HMIS and the ability to look back at services on that client, especially going back 3 years. But again, try to do the best you can. You don't need to, hey, how long were you there? They'll try to tell you, and you can say, Was there any breaks in that time in the past year? You telling me you're homeless? Were you able to be anywhere for any length of time, maybe staying with a friend or family? And if they say yes, then determine how long they were there. And it could be 1 episode or 2 episodes, or it could be multiple, more than that. They may have said, you know, I've been homeless since July, but I spent August with my friend and then he kicked me out. And then I went to my sister's house and I spent October with her. And so there, right there are 3 episodes because they spent July, they were homeless in July. So that's 1 episode. August stopped it. They were homeless again in September. That's the 2nd episode. October stopped it when they stayed with their sister. And now they're homeless again in January. So that's the 3rd episode. So that's what separates an episode of homelessness. And again, that's difficult. So do the best you can in trying to answer those questions. Is that all it?
That was all the questions that I've noted on the chat, and certainly if we'll review after this is to make sure we haven't missed any.
There is one more. It's from Renee. She said, "What day will the survey take place?"
The survey starts on 3 p.m. on the 24th, and it goes through 3 p.m. through the 25th. So we do that evening, and then we do the following day, which is the Tuesday, to 3 p.m. However, we are going out past that 7 days. So you may have an assignment that either is on Wednesday or Thursday, and that's okay, as long as you refer back to the night of the 24th, asking that question number 2, where did you stay on the night of the 24th?
I have a question regarding the family portion.
Okay.
So it says, you know, all family members in the location regardless of age, but then earlier I thought you were saying something about over 18.
In the past, we requested that if they were 18 or older, that they do their own survey. You're not doing that this year. It's whether if they are part of a family in a household, you are going to choose one as the primary client, hopefully not the child, but preferably the adult. And the second member or 3rd and 4th and 5th members can go on that question number 18 piece.
And do the family members don't have to be with us, just the primary family?
Correct. As long as, however, as long as the family members are in the current situation as the primary.
Okay, thank you.
Welcome.
Thank you, Amy. I appreciate it.
Okay, so let me see if I can stop the screen share.
And but if you'll certainly stay available for questions that might come up as I go through a few things, that would be appreciated.
Okay, I'm just gonna mute myself here and.
Okay, so we actually will be communicating via email with just about everybody, and thank you to those that have put your information and recorded an interest in the chat. We'll definitely be getting back with you because, as we've mentioned, getting the waiver, and we also Turning Points has a confidentiality agreement. So we have 2 documents that we'll be asking you to sign, and you can return them to us either in person or scan them to us is absolutely acceptable. If you are going to be training others within your organization, we would ask, obviously, that anybody that's going to be doing the survey, that we do have their waiver and their confidentiality agreement. One thing that came up in one of our trainings this week from somebody that does data entry for Suncoast Partnership, when all this is, when the surveys are completed, mentioned, please write legibly. Please instruct your people to write very legibly. It's, as you can imagine, it's difficult entering all this data in. But again, confidentiality, their information won't be shared with anybody. Statistics are given to HUD. There is one other piece of documentation that Turning Points is asking about, principally for our health clinic. We really want to know if the need for vaccinations. We've certainly provided vaccinations in the past. And so as well as the survey, we're going to have a separate sheet that asks if the person has been vaccinated or would like to get vaccinated, so that we can understand what Turning Points can do going forward. That won't be turned into anybody. It doesn't contain the person's name, so it will be strictly confidential and used by our health clinic. But when you get your supplies, there will be 2 pieces of paper that we ask you to talk with the client about. And speaking of supplies, obviously, to do the surveys, we're happy to come to your organization if you're not an individual volunteer. If you're an organization that serves those in need and you need us to help send volunteers to survey, we will bring those supplies with us. However, if you've trained today and you can survey your clients, that's great. We will get you the supplies. We have them ready now. If you can send somebody to Turning Points, either today, tomorrow, or Monday, or the day that you plan to do the survey, that would be very much appreciated. What we have for you is a clipboard with the 2 questionnaires on it. And we have 10 copies on each clipboard. So if you feel like you're going to need more than 10 copies, just please ask us and we'll make sure that we give you the appropriate number. As Amy mentioned, we have a small resource listing. It's not our path directory, but it is a small one that gives critical services that they may need, especially hotlines and abuse services. We have the maps for the city of Bradenton on the clipboards. However, if you happen to be covering Palmetto, and I noticed on the survey this year, they asked for whether the person was in the Palmetto city limits. We have that map available. Just ask us for it because we're not putting it on every clipboard. If you're surveying in large groups where a lot of people, like outside the Salvation Army, we actually just have smiley stickers. So we can give somebody that's responded just a small smiley sticker, and that way we won't have other surveyors going up to them. We also have some giveaway items, some hygiene kits and a few other things. So definitely want you to pick up as many of those as you can use to give to people that will be surveyed. And last but not least, we have a Turning Points t-shirt for anybody who would like one. With that, I think Tina is on the phone, and Tina has been an amazing volunteer for Turning Points this year, just gathering all the information and making sure that we have the entire county covered, because Manatee is a large county. So Tina, would you like to share the information regarding assignments, etc.?
Sure. So I think we'd like to cover off the logistics for the waivers and the schedule, which people have asked about. So for the waivers, we definitely will be sending you the forms. We'll need to get everyone's contact information, either from this distro or from the chat. But immediately after the meeting, I'd like to make sure that we're able to send those to you along with a copy of the schedule. And I'd like you to return, and there are instructions in the schedule, but I'd like you to return that back to me as soon as possible with your availability. And then we'll be able to really start crunching the numbers and lock down everybody's assignments, particularly for Monday and Tuesday, just so that we head into next week in a good position. And right now, the way the schedule is playing out, we're seeing people signing up for a lot more activities on Monday and Wednesday, and Tuesday, Thursday, Friday. are quite light for some reason. So if you have any availability, particularly on Tuesday, but Thursday as well, it would be great if we can try to balance some of that out a bit.
Tina, some of these individuals will solely want to provide surveys at their agency. Now
Right.
that will not show on the schedule at this time. So they should email you and say, these are the people, here's our waivers, here's the people we will be serving at this location for our agency. Is that correct?
Yes, great clarification, Kathleen, because otherwise people would have seen the schedule and said, hey, we're not on the schedule, and we would have had to address that. So thank you for distinguishing.
But we do have spots available. So if you want to volunteer at any of what is on the schedule, you will see spots available. So please, if you are available, we would love to have you at one of those locations if you have availability to do so. And I think we had a couple of questions. Tina, you answered in the email. I just want to make sure everyone hears. So somebody said, can I pick up the information, the surveys for the other people at my organization? Yes, we just need to make sure that we have the waivers. Either bring the waivers with you when you come to pick up for your organization, or email them in, and then one person, we don't expect 5 people to come out from the same organization. So please just send one person over to get that. We will send this information out after the meeting to everyone we have an email for, and those of you who have added your email into the chat, because I have seen some of you have been adding your email. So we will send it to all the PATH directory, as well as those. We'll send that the information that you need to sign up for your waivers and your confidentiality form. So we'll send that out to everybody. It's, if you are not planning to do the point in time, just disregard it. There's nothing that you need to do at that time. What other questions are there, folks? Well, they get, so I do have a question because I'm not sure. So we have folks from both Sarasota and Manatee on this call. So if they are in Sarasota, and maybe Amy, you could answer this, where do they go to sign up for Sarasota?
If they're in Sarasota, they can contact me and I can send them the waiver. For the material distribution, I have it scheduled to be Monday from 8:30 to 5. Most of our volunteers have already received their locations. However, if we do have people that want to volunteer in the Sarasota, I still have locations that I could use. Just have them contact me at Amy, which is AMIEE, suncoastpartnership.org. And I can put that in the chat here real quick. And then I can go ahead and get them their assignments and locations, because we are in desperate need in Sarasota. I think we've had about 20 volunteers this year.
Gotcha. So
They are
question
really-
for you, if they are an agency, like Castle said, we can pick up for Castle. Now Castle and some of the other agencies, JFCS, do cross boundaries of our counties. So can they go to Sarasota to pick up for everybody? Do they have to split? And I mean, it's the same survey, yes? So can they go to one location to pick up?
It is the same survey. However, we have different thank you bags and costs associated with them. I have no problem if they want to come. I know that our survey we did in a booklet form, and I think your survey you did in a Zoom down. I'm not sure if it's legal or letter on both sides. So there is a little bit of difference between the two, but yes, they can come and pick those surveys up. I do have Castle, actually, some of their people are picking up in the Northport area tomorrow for their locations. And then the remainder, I believe JFCS is picking up in Manatee on Monday.
Okay, and so you can see Renee Hickman just put a message in there, and this will be between Amy and Tina. She's saying she's the outreach specialist for JFCS, and she's willing to go lots of different places that she's identified and wants to know where her assistance is needed the most. Now, Amy, am I correct that Sarasota is only doing the 24th? They're going in the 25th, not the whole week. Is that correct?
No, actually, this year we are going out because the fact that we are so limited in volunteers. So we are going out. I do have Wednesday at the Remnant Cafe, the Resurrection House on Tuesday. We do the feeding on Monday night at the Salvation Army. But there's also down in the Northport, Venice area, there are things that are happening at like 10 a.m. on a Friday that I don't have anybody for. There are also feedings in the evening from the 100 Church. They do it every night. So then there's shower trucks.
Are you doing the whole week then? Are you
Yes.
like Manatee? Okay,
Yes.
so both counties will be surveying then for the entire week. Amy, please put your email into the chat. And so if you are interested in Sarasota County, you'd reach out to Amy. If you're interested in Manatee County, you'll reach out to Tina. If you're interested in both, reach out to both of them and they can assist you with where we have needs and openings still available. And again, yes, when you got the schedule, your agency may not be on it. We're waiting for you to tell us that you're going to do it, and we will add that to the schedule then if your agency is going to be surveying. So just give us that information when you are filling out your waivers. Tina will reach out to you and say, okay, we're gonna add you on here. So that would be very helpful. And yes, we want, if you're not on there, it's okay. If you're gonna do it, we want to have the more the better. So we absolutely want to have locations who are seeing individuals who may be experiencing homelessness to be doing the surveys. So other questions?
I have a question. This is Joanne. Hello, everybody. What about I know you talk a lot about organizations doing this. What about individuals that are that know the community? I have a group of ladies that work in Palmetto, and they are very connected to the community, but they really don't belong to any particular organization.
Yes, yes, yes.
Yes.
100% yes. We absolutely would love individuals. And that's something that I guess we should have mentioned. Thank you for bringing that up. If you have a church group, a book club, a group of people that a neighbor who might want to volunteer, as you heard Amy mention, they still have a great need in Sarasota County. We still have a need in Manatee County as well. So individuals, absolutely, we would love. And they can reach out. If you look in your chat, we have Amy's email and phone number for Sarasota County, and you have Tina's email and phone number. You'll just have to scroll up a little bit to find it for Manatee County, and they can reach out to set up a training.
Okay, thank you.
Thank you. What else?
I have another question.
Sure.
I'm sorry. Okay, there's a lot of locations that we know about that is like what I'm saying, not on the map, let's say, where we already working with some of the homeless that be in the park, like sometime on Sundays, we just go down to Sutton Park and we just feed the homeless that are there. So there's a lot of little areas like that that we are aware of. I don't know if y'all are aware of them or what, but there's little pockets that we go into sometime, as well as in Manatee County. There's those, we actually go into some of the little, villages that's in the, I know you don't suggest going somewhere that is not, safe, but what I'm saying is that we do already have some connection in those kind of places. So we would, I'm going to talk to them and find out if those are the places. Now, do we need to give you that information on where they are? Or just
yes. You'll want to talk to Tina because she's coordinating where we are actually doing the count.
Okay.
So we want to make sure that we know where our folks are going. We want to know where, we want to make sure for your safety as well, that we know where individuals are when they are there, and to make sure that if that's a place we need to add, if you're able to get quite a few folks, we may want to add that in next year to make sure that we get touches there next year. So please just have that conversation with Tina. We reposted her phone number and email address at the bottom there, so it's the most current in the chat. She's happy to have that conversation with you.
Okay, thank you.
Absolutely.
And Kathleen, I wanted to add that definitely, even on our list of assignments, we have places like the parks in Palmetto and other outreach areas. We kind of have a separate list for that, to all the places that people have mentioned that the homeless may congregate. So definitely people that are willing to go out to those places are very much appreciated.
Absolutely. All right, what else, folks? Any other questions? All right, they did an excellent job then, Amy. There's not too many questions out there, so thank you so much for that. Thank you, Maureen and Tina and Amy. This is really a big undertaking. And as you already heard, though, it's an important one. It's something that's really important to our county. It's important to those who are experiencing homelessness, that we in the agencies that are serving them, so we can really see what's happening in our community. So we really appreciate that. There is still time to spread the word if you have folks who would be interested in doing surveys, either at a location that we already have, or if we want to add some, please reach out to Amy or Tina so that we can coordinate that. And for those of you who are ready to go, we absolutely appreciate you in doing that as well. So we will be sending out lots of information after this meeting. Again, if it's not relevant to you, it's okay to just disregard. If you are interested in doing the point in time or have someone on your team, make sure that they're paying attention to the email that's coming out, because those waivers and confidentiality notice are very important. And we want to make sure we also get you the surveys and the information that you need. So. All right, everybody, I really appreciate your time and everybody staying here for the training today. And hopefully it'll be an awesome point in time and that we're able to really touch a lot of folks and get that snapshot. So thank you for that. Happy New Year, believe it or not, end of January already. Not sure how that happened, but thank you all for that. So we'll be paying attention again to pay attention to your emails. We'll be sending out this information. And if you have flyers you want to share with us, like the Fathers Program, like the mammogram, send it on to our path@tpmanatee.org email, and we will make sure to share that with the entire group. So thank you all so much, everybody.
Bye.
Take care.
Thank you.